Alright, hello guys. Welcome to STS 1178. This will be your second term. We completed the first term, all except for the lab, of course. Hopefully we'll be back on campus someday, but we're going to continue to build a great foundation here for when we do get back. We're going to start in we're going to do chapters 5, 6, 7, and 8 this term, so we're still dealing with some basics and some foundational stuff. Chapter 5 gets into identifying some of the equipment that is in the OR, how to deal with it, what it's called, kick buckets, Mayo stands, the flow of the operating rooms, restricted, semi-restricted areas. So just a lot of basic stuff you need to know, especially if you've never been in an OR before. Chapter 7, we also go through some minimally invasive stuff. Well, that's chapter 6. Minimally invasive, which you'll be doing quite a bit of in the lab, learning to handle cords, cameras, and all those kinds of things that we've talked about already a little bit. Chapter 7, preventing perioperative disease transmission, how to handle sharps, what can happen when you don't handle them properly, preventing disease transmission, a little biology in chapter 7, and chapter 8, I see surgical conscience again. Surgical conscience is everywhere. Chapter 8, emergency situations, how to handle various hazards like malignant hyperthermia, cardiopulmonary resuscitation, all kinds of good stuff. So, glad to have everybody back. We're going to also throw in a lot of instrumentation I happen to have here. You should know what this is, I would think. Let me give you a second. See if you can identify this. It is not suture scissors. Suture scissors have a real thick shank here, pretty heavy duty, like Mayo, which are Mayo scissors. These are Metzen bombs, real delicate, blunt on the tip, used for dissecting. It will be pushed into the tissue, opened up, pushed in further, opened up. And this is the way a surgeon can get to where they're going without having to cut any tissue. They also use their finger. Their finger makes a good dissecting tool as well. So Metzen bombs. Want to know how you pass these? Surgeon puts his hand out, you put them right in there. It goes with it. So you're always up here out of the way, pop them in there so you can feel them. You know, unlike most people, here are the scissors. Nope, he wants them popped into the palm of the hand so he can go in that way. So that's what we cover in lab. So anyway, most people did pretty well the first term on academics. I'm not too hard sometimes on that but it's up to you to get the material. I already know it, right? You're the one that has to learn it. So you got to be diligent you got to be disciplined and diligent in your off time. Keep going back and reviewing. You don't have to study and memorize. Just look at it, read it. Keep familiarized, just like the lyrics of a song. Every time you look at it, go through it, it sinks into your brain. This is the exact same way. There's a lot to learn. We're going to do some medical terminology this term. We'll do maybe some anatomy, physiology. We shall see. But we're going to get better, aren't we? We're going to get a lot better on a lot of things. This is the term where we sort of turn it around. We sort of start learning what's required, what's expected, and we start making improvements. Lots of things this class needs to improve on. One is details and focus. When I give instructions, get one of these things out. I think you've probably seen one of these before. This happens to be a pilot. And the way you use this is what you're going to do is depress this little thing right here. See that? And that writes on paper. So you can make notes. And you can write it down so you don't have to ask me over and over again what I just said 2 weeks ago, because I can't remember either. So don't make it hard on me. Write stuff down when I tell you. Ask you to do something, write it down. Write it down when it's due. And please, please, please get out of the habit of finishing up something on the date it is due, or the night before. Not good. The night before, the day of, you should be reviewing, and that's all. You should finish things up way ahead of time in order to do quality work. Okay, so let's get in the habit of that. But primarily, let's get into the habit of having an attention to detail. Let me show you something here. This is a picture I took of a count. Sometimes some ORs keep up with counts on paper, on a clipboard. Some of them have a whiteboard on the wall in the room so everybody can see it. And they'll use dry erase markers and they'll write on the whiteboard. This is a picture here of a whiteboard, which you can see a lot of green writing. I probably can't read that. All the green is under the heading of needles. Those are suture needles. And then up top there's, you can't really see that. It's probably a bad picture. Up top there is the number of sponges that are used. So these were all the counts, items that were counted for this particular surgery. There were 160 needles. That means 160 sutures. Right, 160, not 4 or 5, but 160. There were also 65 laparotomy sponges, so 65 packs of laps, as we call them. There are 5 laps to a pack, so that's a lot of laps. What's that? So, let's see, 15, about 14, 13 lap packs. Anyway, there's a lot of stuff to keep up with in an OR. This was a fairly big case, but all this stuff has to add up at the end of the case or it's nasty. The surgeon blows his top. We have to wait for radiology to come in and take x-rays. We can't find stuff. Where is it? Is it in the patient? Blah, blah, blah. So as you can see, the demands are just going to be real life someday. They're going to tell it to you one time and expect you to get it. So let's start practicing that right now. Let me just go over a few things here to help you out, because this is the mind, and I understand this. We go through this with every class. We want our students, again, to go out to clinicals just looking like somebody who's already worked at another hospital. How's that? That's a good way to look at it. Not like a student, because students will come in from other schools expecting to learn how to work in the OR. Ours are going to be ready for the OR when they go for clinicals. In our career, mistakes can kill people. They can cause infection. They can cause loss of limbs. There's nothing good about it. Focus and attention to detail. Write things down. Make notes. Keep a calendar. Think about others. Oh, here's a good one. Think about others rather than yourself. We're all, especially at your stage, you're all prone to think about, well, what do you need? What's best for you? You're getting into an area now where what is best for someone else? What makes Mr. Young's life easier? Is it that I don't write anything down and I ask him when it's due again at the last minute? Or do I go ahead and do everything to make his life easy because he has 10 other students, not just me? Because when you get into the OR, you don't want people to have to mop up your stuff. You want to be the one that they can depend on. Okay. The conditional grade form. It took a while for us to get that right. I did specific instructions on what to put where, what the course was called. I got forms back that didn't fill in the course line. I got forms that called the class instead of 1177, it was 1107. So, guys, we simply got to listen, make notes, pay attention, check your work. Always double check your work. Don't rush through it, do it, send it in, and make me have to do it. Because I try to be nice the first term or so, but after a while, if it keeps up, then I have to start counting off. I don't want to make everything you do a grade, okay? I treat students like adults until they start acting differently. So I want you to change. I want you to get better, okay? Because we don't want to have to do participation grades and, you know, fill out this form and there's a grade for filling out the form. I don't want to do that kind of stuff. Let's see. There was a let's see, what was this? It was might have been an assignment question, and I can't remember which assignment it was that everybody missed because they didn't look up the word induction. That's it. Induction. You're going to run across a lot of words that we use that have civilian meanings, and then they have medical meanings. So if you ever run across a word that you don't know what it means and how it applies, all you have to do is go to your Google box. If you don't have a medical dictionary on your app, go to your Google box and type in, what does this mean for medical? So the word induction, you could have looked that up, and you could have determined that meant intubation of a patient. That's the induction process. And it's kind of a weird word, but it's kind of inducting them into the state of asleepness so we can do the surgery, the induction. Nobody looked that word up, so everybody missed that question. So look up the medical meaning of words that you're not sure about. If you have a question about anything, ask. Don't do something without asking, walk away, and leave someone else to clean it up. Please. You've got to get out of that habit. I don't know what you're used to or what you're accustomed to, but you're on your own in this business. You either do it right and you do it fast, or they find somebody else to do it. So let's get used to that right now. Communication. If I ask for something and you say okay, then I assume you got it, and you don't have any questions. You're going to do it right. So the other thing with texting, if I text you, I expect you to text me right back. We've already gone over that, but we've also got to get more specific in our texting. For instance, if I text you asking where was that thing you were going to do, and you tell me, well, you're going to be home in a little. Okay, well, a little means 2 hours. A little can mean 5 minutes. A little can mean 6 hours to some people. We need to be specific. So I'll be home in 30 minutes. Okay, then I can go about and do something else, and then I can check back in 30 minutes and get what I need from you. This is what is going to be expected in the OR. This is not me, okay? I'm getting you ready. This is why our students are so good, because of the little things that we work on. We teach you all the other stuff you got to know, but we also work on your little habits that you don't need anymore. So get used to communicating, specific communication. I will be there shortly. No, I will be there in 10 minutes. Yes. I train my students to do this, so get used to doing that. Just to be accountable. Don't forget what you promised to do. Don't forget what you tell me you're going to do. Be accountable. So as you can see, there's a lot of personality, a lot of personal characteristics here that people have to alter and change in order to be successful in this business. We don't want the clinical ORs not going to want to have to work on this. They've got enough to do. They're letting you into their facility to train you on real live patients with real live doctors. So they're not going to want to work on your personal characteristics. They're going to expect all those to already be polished and eliminated and made more efficient and clear and specific. So by the time you get out of here, by the time you get past me, you will know how to communicate specifically. You will know how to take instructions, how to write down what you need, how to ask questions for the things that you don't know, and then get on with it, okay? So I'm going to end this video with, if you would, as soon as you finish this video, text me the word, let's see, Kaiser University's color is blue. How about that? I want to make sure everybody goes all the way with this, and we'll see if anybody's trying to maybe not listen to these outstanding videos. Okay? So there'll be more to come this week. It's instructional. Just want to get you started off with this. Okay? All right. Look forward to seeing you tomorrow. We'll start with the pretest. Bye.